And while the corridors of power over in Washington wrestle with the politics of vaccines, states are now stepping in to chart their own course. This week, in fact, Florida Surgeon General announced that the state plans to end all state-imposed vaccine mandates, including the long-standing requirements for children to attend public schools. Meantime, Democratic governors of Washington State, Oregon, and California created the West Coast Health Alliance to establish their own recommendations for who should be getting vaccines. Here to help us make sense of it all is Dr. Jodie Guest from Emory University's Department of Epidemiology. We want to welcome you to The Take this morning, Dr. Guest. Thank you so much. So let's talk about this from a public health perspective. How big of a divide does this create when you have so many different directives?
You know, it just shows additional lack of consensus and will cause a bunch of confusion. But most importantly, it's going to change the health of our country, and it's going to end up with multiple groups of people, with those who have access and those who do not.
And, you know, we heard just before we came to you about some of the different policies and some of the different directives. So you have kind of a patchwork of policies out there. Does this ever become a national health risk?
Absolutely. You know, again, confusing information, changing guidelines, different people putting out different guidelines. No one knows exactly who they should be listening to. And we're used to listening to one voice from the CDC.
Yeah. So how much of a risk do different communities or even states face if vaccination rates, let's say, drop in certain states but then remain steady in others?
Well, we're a mobile nation, and so we don't stay within our own state, but we will see differences. And those who have access to vaccines will be safer than those who do not have access to the vaccines.
Mm-hmm. And there's so many different views when it comes to communities and just individual families about the vaccines. Do we fear that perhaps we could see people even maybe crossing state lines just to get the shot?
You know, we'll have to see what kind of guidelines are put in place to allow that or not allow that. I would imagine there will be attention to that, and you will probably need to get vaccinated in your own state. But we're in a really unusual time, and so I don't know for sure how that will play out.
Yeah, we'll all just have to see. Now, we know Georgia still does require standard childhood immunizations, but they've limited COVID-19 mandates. How does that position here in the state kind of play into the national conversation?
You know, Georgia is on the lower side of vaccine uptake, and that's always been something we grapple with here in this state. We are below the threshold we want to be for childhood vaccinations. But when we limit choice and we limit parental choice for access to, for example, to COVID vaccines, we are taking that away as an option for parents who want that for their kids. And I think that that is not the right way to approach public health.
Mm-hmm. And do you think at all from your perspective that we could see outbreaks of diseases that we thought were pretty much gone?
We're already doing that. We see, you know, we have the largest measles outbreak in the past 2 decades going on in the United States. And that is because we have seen decreasing rates of the vaccine that prevents it. And so we're about to see additional viruses as well spread, viruses that a lot of us have never even seen in our lifetime.
Mm-hmm. And, you know, we report different stories here. We heard from HHS Secretary Robert F. Kennedy Jr., then we hear from the CDC director who's now been fired, and people hear from their own state leaders. How does all this mixed messaging affect people's willingness to trust science overall?
This is one of the main reasons we're seeing a lack of trust in science. That inconsistent voice and the disagreement about what science is showing us. And we have a lot of evidence. We follow the evidence. That's what we do every single day. And we need to work very, very hard to build back our trust. But at the moment, these multiple voices and these arguments about what is the right science is not helping us.
And what advice would you give finally to people, as you alluded to, who get caught sort of in that middle ground between politics and science, to maybe reassure them that they're going to be okay?
So we know vaccines are safe. We know that the primary reason we want to use them, and they are the right choice for your children, is they keep them safe and they help them lead long and healthy lives. And that's the goal. That is always the goal with this. And we want to keep people not dying from vaccine preventable illnesses. So the science is still there. The science is still strong, and we have a lot of trust in the data and what it shows us about the vaccines.
All right, Dr. Jodie Guest, we appreciate you joining us this Friday morning. Thank you.
Thank you.